My name is Wanjiku. I'm a counseling psychologist. The topic that I want to discuss today is mental depression. The whole country is now crying silently about the fact that we have a very big problem related to mental depression. Every day we have reported cases, even not only in Kenya, where we have homicide, suicide, and many other related problems that result from mental depression. Coronavirus has contributed, if there was any, to the escalating rate at which we are seeing the depression around our people. Often we confuse the temporary situation that we are in and where we describe ourselves, I'm feeling depressed. For example, if you had a car problem in the morning going to work, you can call a friend and say, I'm feeling so depressed because my car broke. Or I'm feeling so depressed because my babysitter did not turn up. I'm feeling so depressed because my child was sent away from school. I'm feeling so depressed because my cow is sick and I could not get the veterinary doctor. So things like that. Those are temporary situations that we find ourselves in, but we often confuse it with what is the depression is. Depression is a situation where we are robbed so many aspects of our lives, our happiness, our humanity, our jobs, our relationship with other people, even our ability to cope with the things that are normal in our daily lives. It can even also rob us our own lives or lead us to terminate other people's lives as a result of depression. This is something that can occur to anyone. It has no age limit. It has no gender. It has no social status. It has no tribe or race. It can happen to anyone. It doesn't matter who you are and what you do, it can happen. There are signs that indicate that something is not well or something is going on that is not well. For example, a person who is normally very happy, very friendly, interact with the people very easily, suddenly they don't want to see anybody. They want to be alone. They don't want to talk to somebody. If you come to their house, they go into the bedroom. And if they normally go to places with other people or go to certain social places, they don't want to turn up to those places anymore. They just want to be alone. The other thing that you find is that if this person was a person who is very clean, caring about their body, about what they wear, suddenly they don't care what they are wearing. They don't even wash. They don't even care how they look. They don't even, if they are male, they don't shave. Or if they are women, they don't even bother to comb their hair. And you see that they can wear a gown that they had been used in the bed the whole day without even thinking about taking a shower. And they'll be comfortable with themselves. Even they come to a point where they don't even brush their teeth anymore. They can overeat, or they can fail to eat, and overeating make them gain a lot of weight, or sometimes when they are not eating, they lose a lot of weight. Any of those things can happen when a person is depressed. They can start failing to go to work, and gradually they can terminate their work without being terminated by anyone. They often will lose temper, shout at the people, pick a quarrel when they are provoked by something very small. It can even be a goat has eaten a soap. That's enough for him to beat a wife. Or something the child has done, and you find that the mother beating the child very badly is an outlet of the steam, because already they are boiling and they want to let out the steam. They can also start feeling that people are talking about them and feel very uncomfortable around people because they think that people are gossiping, talking about them. If they drink, they can increase their drinking habit. They become regular drinking habit, and you find that they will go to an extent of overdrinking. Sometimes if they are smokers or if they take drugs, they can escalate to that behavior. So those again are other symptoms. If there were people who were like involved in social activity like churches, choir, and all that, suddenly they will withdraw, or even groups that they normally interact with, they will withdraw from these groups. If there are people who have their own businesses, they run their own businesses, they suddenly, you see them stopping, not going to work, don't care about opening the businesses. So they just close the business and stay home, or just wander around or go to other places just to hide themselves and not to be with anyone. They prefer to be alone most of the time, and they talk less. And they are very uncomfortable around people when they get to a certain level. And there are times when they feel that they no longer need to be here. They don't see the reason why they should be here. They don't see their self-worth. And so all those are symptoms that their lifestyle, their personality, things are changing. People around us are the first people to notice. And it should be the first people to notice that something is not going on well. The other thing is that the victim themselves should notice that things are not well, and they should start seeking for help, or people around them should recommend for help, because a spouse can notice when their partner is changing. A parent can also notice when the child is changing, a younger person is changing, and they can see there are things that are happening in the life of this person. And so, since we normally recognize and accept diseases and talk about it very freely, like for example, if I'm diagnosed with diabetes or high blood pressure or cancer or kidney issues or headache or migraine headache or even back problems, I can easily talk about it. We can easily talk about those things. Equally, mental depression should be openly discussed around the people that are in our lives, around relatives and friends. Unfortunately, the attitude that we have in the society toward people with mental depression is very bad. Even the terms, the names we use to describe the person when they are in those states is very nasty. And so most of the time, we find it very uncomfortable to talk about it. Number two, we also don't know what to do or where to go, because we have all kinds of doctors everywhere treating all other kinds of diseases, but often we don't know what to do and where to go for a person with a mental depression. The first thing is go to the nearest doctor. The doctor that you go to will be the gateway to other services that you need, because they'll diagnose you, and once they diagnose you, they can decide where they will refer you to. Most of the time, after initial treatment by a medical doctor or a psychiatrist or whoever is going to treat you for that matter, you normally might be recommended, which is highly possible, to see a therapist, to be seeing a therapist, or to go for counseling services. Those things are available around our society. Unfortunately, we have not had enough medical professional or people who are professional in those areas. And so sometimes you may find that it has been very difficult in the past to look for those services, although today they are available everywhere. And there are many training institutions that has come up with the specialty of those kind of illnesses. It takes a human being. In a society, I can say that it takes a human being to help another person. The people around us are very, very useful. They are very, very important to help us toward recovery. Whether it is friends, family members, or the people we interact with. One of the things that we should avoid when we are interacting with that person is to accuse them, to condemn them, to blame them for whatever they are going through. Sometimes we have seen this is a depressed young man because he had been looking for a job, all day long, and he come home, and the first thing is that, did you get a job? You're not looking for the job. You're not even putting enough effort. Why don't you do this and this and that and that? So sometimes these people become very upset because they know all day long they have been going around taking their CVs everywhere. And now the last thing they want to be reminded that they are not doing anything is when they come home. I remember recently, a parent kept on asking their son, how come you are not working? How come you're just sitting here at home and like a pest? And we are feeding you, we are giving you a praise, you are old enough to be out there looking for a job and even be on your own. This young man, after being asked very often by the parents, he did the worst. He came in the house with a gun, shot the mother, the father, and the daughter, the sister. And that was the end of the story. We are seeing so many of these incidents of homicide or suicide as a result of the mental depression. We have to be very careful about how we go about treating or talking to these people. We are used to nag people.